So, um, first, I want to just quick do a little reminder around testing. So, as we all have shared today, we know that Thanksgiving was last week, and hopefully everyone had a good Thanksgiving. I know it was very difficult and very different this year, but again, as people have already shared, we are doing this with a purpose in mind. We are doing this so that next Thanksgiving and even the next few holidays don't have to be as difficult moving forward. So, as it relates to testing, again, our three Milwaukee Health Department sites are open and available for testing for COVID 19. Please go to the Milwaukee Health Department's website to get those specific dates and times that they are available. As it relates to testing, though, just a reminder that if you are experiencing symptoms or if you were gathering over the holidays, that the window for ideal testing is that 3 to 5 days. And right now we're at about that 5 or 6 day mark from actual Thanksgiving Day. So if you are experiencing symptoms, if you are hearing from others that you might have gathered with that they are experiencing symptoms or that they have tested positive for COVID 19, you absolutely should be getting tested. Additionally to that, again, with the flu season, we know that there are lots of symptoms going around, and that flu symptoms can very much mirror COVID 19 symptoms. So, even if you don't feel, or if you have very mild symptoms, we encourage you to get tested right away. Do not wait. There is not a need to wait. Contact your healthcare provider, or again, make sure that you're visiting one of the Milwaukee Health Department sites to get tested. Additionally, even though the 3 to 5 day range is ideal for testing for COVID 19, we know that symptoms can arise up to 14 days after exposure. So continue to pay attention to yourselves, pay attention to your bodies. And if you, again, develop any kind of symptoms, please go and get tested. I want to also touch on our overall vaccine planning for the city health department. As you all know and might have been hearing, there's lots of work being done around vaccines, and it's something that the health department and our country really should be excited about. We've said a couple of times now that there is light at the end of the tunnel. We are moving forward with that in mind, but knowing that the next few weeks and month or so, we will have to continue to double down on our mask wearing. Mask wearing is just as essential today as it was a month ago, as it was 2 months ago. Washing your hands is just as important. Watching your distance is just as important. So the Milwaukee Health Department is working. We've already convened our planning group as it relates to COVID-19 vaccinations. And through our process for vaccination planning, we are paying attention to all of the things that we have learned so far as it relates to COVID 19 and mass vaccinations, whether it be our mass distribution or our COVID 19 testing. Also, we will continue to look and get guidance from the CDC as well as the state and working with our county partners. So right now, we continue to wait for final FDA approval for the two vaccines from Moderna and Pfizer. And what we do know is that these vaccines will be most likely delivered in two different doses with a time frame in between them, and that at least the Pfizer vaccine does have very specific storage requirements. And so what that means for us in the health department is that there are lots of logistics to be worked out and challenges that we are in the process of working through so that when the vaccine hits our door, we are ready and comfortable and confident that what we're doing and how we're doing is going to be safe and effective for the public. One of the questions that we are getting a lot in the health department is who is going to be eligible for the vaccine first, and will I be a part of that first group? Again, we're going to work with the CDC and work with our state partners on the actual groups of individuals that will be tested, or excuse me, will be vaccinated first. But what we do know is that there will be some type of phased approach. And in that phased approach, most likely healthcare providers and long-term care facility residents will be in that first group, followed by essential workers, firefighters and police are in that group, as well as educators. The next group would most likely be high-risk individuals and individuals over 65, followed by the general public. And we don't expect the vaccines for the general public to be available until the spring of 2021. So again, the light at the end of the tunnel is there. We just have to make it there. Also, the Milwaukee Health Department, we are working on all phases of that distribution. And as that information becomes relevant, we'll make sure to share it with you in this form as well as on our website. That is all I have. I will turn it over. Thanks so much.
Thank you, Commissioner Jackson. Up next, we have Dr. Dan Waxman from Versity. Dr. Waxman.
Thank you. So with the number of COVID-19 cases going up, it also is paralleling the number of patients being admitted to hospitals. And with that, the need for COVID convalescent plasma has increased. We have been collecting donors who have recovered from COVID-19 since going back into April. And we have had a steady number of donors throughout the spring and summer. But early fall, we started to see the usage climb so dramatically that it is now twice what we'd had previously. And it is exceeding what we're collecting each week. We're doing a great job in Wisconsin. Every donation can be made into 3 to 4 separate products, which can treat 3 to 4 separate patients. And you can donate weekly up to 12 times. So once we have a donor into our blood center, we're able to have them come back on a weekly basis to provide these products, which for some patients are truly life-saving in terms of helping them with their therapies. And so, we are asking for hospitals who have been very good in terms of referring people who've recovered from COVID. The other thing is, just as there is this need for convalescent plasma, there's an ongoing need for regular blood products, red blood cells, platelets, and other plasma. That has not gone away. And in fact, since the pandemic started, we have not had access to 20 to 30% of our normal blood donors, which is high school students and students in the universities. You can donate blood as early as age 16 with parental permission. And since the early spring, we have not been able to draw donors at most high schools or universities. And so we need those donors to come in because regular therapeutics are going on, transplant surgeries, heart surgeries, unfortunately, trauma surgery. And so we need the other blood products too. Now, ever since about a month or so ago, every blood donation that is done, whole blood, platelets, or otherwise, we're testing for COVID antibodies. So we're able to find people who never knew that they had an infection, and now they have the antibodies. And it's these antibodies that are in a person's bloodstream. That's what we're using as a therapy for patients who are critically ill in hospitals. It's called passive antibody therapy, and it's something that we can't manufacture, something we can't create in a lab. It comes from one individual who's recovered from COVID-19, and we're able to transfuse it into an individual who's currently ill and in the hospital with COVID-19. So we have an easy way for people to get a hold of us. It's just go to versity.org, versity.org/COVID-19 plasma, or 877 be a hero, BEA, a hero. And that way people can contact us to either be a regular blood donor if they're fortunate not to have had COVID, but for those people who've recovered from COVID-19 or now have found they have antibodies, we really need them to become convalescent plasma donors. That's all I have.
Thank you, Dr. Waxman. Our first question comes from Ashley Sears at Fox 6 News for the mayor. Will businesses be fined $5,000 on the first violation? Is the maximum $20,000?
We are working with the health department right now to see if there's a gradation. What happened with the council is that they took the fine from one level to another level. That's the maximum. So we are working with the city attorney's office to determine exactly what the gradation should be. But it is true that if a business does violate separate parts of this, there's a multiplier effect. So again, we'll have more information as we work with the city attorney's office so that people have an understanding of that. But the message loud and clear is don't violate, follow the law. That's what we're trying to do right now.
Thank you, Mayor Barrett. Our next question is for Commissioner Jackson from Allison Durr at the Milwaukee Journal-Sentinel. Commissioner Jackson, when do you hope to finish the health department's plan for distributing the vaccine? And how does the role the health department will play in vaccine distribution differ from other entities that are also going to be distributing it? For example, healthcare systems.
Yeah, I don't anticipate we're going to be finished with the plan before the end of the year, simply because we still are in a process of waiting for an actual date of approval from the FDA, as well as an actual date of arrival. As far as the participation of the health department as it relates to other areas that would be able to distribute. So the health department has applied to be a vaccinator for COVID-19. Other areas that can apply are places like pharmacies, of course, hospitals and healthcare organizations. And so we are going to be playing our part in that overall, effort to vaccinate.
Our next question comes from Rose Schmidt at CBS 58. We're seeing daily ventilator usage at an all-time high in the county over the last week. What does that mean for the supply going forward?
Yes, we have seen a small increase in ventilator usage. However, there's been no major upward trends. There's quite a bit actually of capacity for ventilator usage. We're seeing a lot less COVID patients now being put on ventilators than we did towards the beginning of the pandemic, in large part due to the increased knowledge of the detrimental effects of ventilators on COVID patients. So at this point, it seems like we have quite a good, healthy supply of ventilators moving forward.
A second question from Rose Schmidt at CBS 58. DHS data show as of today, there's 421 facility-wide public health investigations in Milwaukee County as it relates to nursing homes and long-term care facilities. Are cases in nursing homes continuing to increase in our area? With public health resources so strained, how are you keeping up with these investigations and contact tracing? Anything else you want the community to know?
So I can just speak from the health department's perspective. Our lab and our medical services team are doing our best to support all organizations that are looking for support from us as it relates to not only contact tracing, but as well as lab support. So we are doing our best. And I think our lab has risen to the occasion. I think our contact tracers have risen to the occasion. But I would also say that that is not without the help of those particular organizations as it relates to contact tracing and being very cooperative in regards to mitigation steps.
Our next question comes from Allison Durr at Milwaukee Journal-Sentinel for Mayor Barrett. Does this mean you will sign the legislation related to the $5,000 fine for businesses? The city site doesn't show that yet.
Yes, but we've got it basically signed and we'll be returning to the clerk's office. So yes, to answer the question directly, yes, I am signing it.
Thank you. The next question comes from Ben Wagner at WISN for Mayor Barrett. Does the $20,000 fine accumulation limit mean that that's the maximum an establishment can be fined, or could a business rack up multiple fines if violations are found on multiple visits?
Well, again, they certainly could if they had multiple visits. I would expect that if an organization, if a business is fined the first time, that they'll learn from that. I can't guarantee that. And again, I want to stress this. This is not about us making a lot of revenue on fines. That's not what our intent is. Our intent is to have businesses work with us to follow the law so that we can end this pandemic. The more we can have people honor the social distancing, the masks, the limited size, the faster we'll get through this. That's the entire intent of what we're trying to do.
That is currently the last question we have in chat. I'm going to give a last call for questions for our speakers and panelists. All right. That concludes our briefing for today. Thanks everyone for joining us. We'll see you back here on Thursday.
Thank you.
Thank you.